Hello everyone. Today we will talk about carpal tunnel syndrome. So carpal tunnel syndrome it occurs because of the compression of the medial nerve at the wrist. So the compression is from the transverse carpal ligament because the nerve kind of runs below it. So this is the transverse carpal ligament, and this is the median nerve. And so the clinical presentation of this would be there will be numbness and pins and needle kind of sensation and pain over the areas that are supplied by the median nerve, and these include the first three fingers and the medial half and the radial half of the fourth finger. So these are the areas supplied by the median nerve, and this is the palmar aspect. Okay, this is not the dorsal aspect. This is the palmar aspect of these fingers, and the area of the over the thenar eminence will be spared, and the reason for that is because the palmar the superficial branch of the superficial cutaneous palmar branch of the median nerve runs above the transverse carpal ligament, and so it is not compressed. So that's an important thing to be aware of. And then there are a couple of tests that are done in order to clinically evaluate carpal tunnel syndrome. The first one here is a Tinnell test. And so in Tinnell test, what happens is that the carpal tunnel ligament, the transverse carpal ligament, is kind of like tapped at the wrist, and this will kind of compress this nerve, the median nerve, and this will reproduce the symptoms like the pins and needles sensation. Another test. So this was a Tinnell test, and this one is the Phelan test. So in the Phelan test, it's sort of like a reverse prayer kind of position that that the patient kind of adopts, and that reduces the pain. So the wrists are hyper flexed, and with the dorsal aspect of both the hands kind of touching each other. So that's the Phelan test, and this will reproduce the symptoms. So what are the causes of carpal tunnel syndrome? These include, like, obesity related conditions can cause it, and also there is like, for example, diabetes is associated with obesity. So diabetes, fluid retention, for example, in pregnancy, there can be fluid retention that can result in carpal tunnel syndrome. Acromegaly can cause carpal tunnel syndrome, in which there is excess growth hormone, and neoplasms, any neoplastic disease, for example, if there is any metastasis here, it can compress the nerve. Hypothyroidism can cause it because there is accumulation of glycosaminoglycans which cannot be cleared by the body, and so that can result in compression. And then amyloidosis can result in compression. In amyloidosis, there is kind of there's a extra protein that is deposited in various parts of the body which cannot be cleared. So that can cause. And then idiopathic is important because here we do not know the reason of the carpal tunnel syndrome. Then autoimmune conditions like rheumatoid arthritis, because of all of the inflammatory changes that occurs. So then coming down to the diagnosis, we have the diagnosis is mainly clinical, and then if there is any high suspicion, if clinical presentation is not really not clear, then tests can be done like the nerve conduction studies. It has really high sensitivity and specificity, so it's a really important test to kind of confirm the diagnosis. So then coming down to the treatment. So the treatment can be conservative or non-surgical and surgical. So the non-surgical treatment include wrist splint. So the patient usually complains of pain at night, and so there is a wrist splint that can be used where which kind of holds the wrist in a flexed position, so there is not a lot of pressure on the median nerve, and so that's important treatment. Then second, if that does not resolve the symptoms, then NSAIDs can be added, and then steroids can be added. So if nothing works, then the final treatment is surgical. And in surgical, the surgery is called the carpal tunnel release. And what happens here is that the surgeon kind of cuts through the transverse carpal ligament, and this will relieve the pressure over the median nerve. So this is all about the carpal tunnel syndrome. And in carpal tunnel syndrome, the motor branches are not affected, so there won't be any motor symptoms. So it will only be the sensory, the pins and needles, and that sort of thing. So hope this was helpful.